Okay, so you're welcome back to the AM show. Time now for us to do some health-related issues on my banner. And let me quickly read just a piece of this particular one for you here. And now 2014 saw Ghana recording over 30,000 cholera cases with more than 150 deaths. The Greater Accra region was not left out as it recorded the highest number of cholera cases during the year 2014. You're told we recorded over some 20,000 cases only in the Greater Accra region. So today on the show, I'm having the Greater Accra Regional Director, Dr. Linda Van Otu. She's Dr. Mrs. Linda Van Otu. Let me add that just so I get it right. I'm also joined by Deputy Director of Public Health for the Greater Accra region, Dr. John Betson Eliza. Thank you so much for joining us. And together we'll be having a review of 2014 and how we fared, and moving forward, what we need to do right this time out. Thank you so much for joining me.
Welcome.
Okay, so Doc, how would you assess 2014 health? So many cholera cases.
Let me first of all say good morning to everybody, and also wish everybody a wonderful new year, a healthy one. Free of cholera. Free of cholera. Yes. And I would also want to take the opportunity to wish all Infantiman girls, old and new, a happy new year. Okay. Obrani Warabo. Okay. Yes. 2014, well, as you rightly said, we had a huge number of cholera cases and over 20,000 with 121 deaths as
in
at
Accra
now. Yes, alone. In Accra alone. And that took quite a chunk of our time because we had to focus so much attention on cholera, on how to manage the cases that were coming so that we would not record deaths. Unfortunately, we had deaths. Now, the sad thing is that some of these people got to the hospital already dead. Some of them died a few minutes after admission, which means that though they had the disease at home, they delayed before coming. But for those that came to us early enough, we were able to save a lot of them. Let me also be quick to add that WHO has a standard of looking at how we manage cases. So, for example, if you have 100 cases of cholera, less than one should die. And if you look at the numbers that we had, the 20,000, and you look at it proportionally, we had about 6.6, which means that out of every 100, less than one died. So those who came to the hospital actually received quite a good care in terms of managing them so that they would survive. The numbers were huge, such that at a point in time, some of our facilities had to turn their outpatients department into cholera reception areas. So cases that had to come to the hospital were asked to go to another facility. And we had to put more staff there, look for more infusions, look for more tablets. Everything had to be doubled or even tripled for us to be able to manage them. And that was a huge burden for us as the Greater Accra region.
Wow. Over 20,000, Dr. Eliza, 20,000 cases in Accra alone out of the over 30,000 we are told. What does that speak of the situation in Accra? Is it that Accra is so dirty, or we are not doing as much as we are supposed to do as health personnel? Where from that?
Thank you. And let me say good morning and happy new year to our listeners.
And viewers. Anyway.
Thank you.
Yeah.
The issue is this. Greater Accra, we're dealing with a population of 4,530,000 plus people living in the smallest geographical space as far as the regions are concerned. So to start with, it means we are very densely populated. And once you have that, and you don't have the requisite amenities like toilet facilities, water, and those things, already you are provided the breeding grounds for those diseases that are water related or sanitation related. In Greater Accra, you know that we have one of the biggest challenges when it comes to waste disposal. Here, I just mentioned waste. I didn't distinguish because we don't even separate our waste into liquid and then solid. So you realize that we have produced grounds where our water bodies and even food items gets contaminated because people defecate everywhere, anywhere, at any time. And as such, once that happens, the water we take and the food we take in is contaminated with cholera. And so most people can easily be affected. The good thing is that though a lot of people are exposed to cholera, it's only a few that actually manifest the clinical symptoms that we see. So if we have over 20,000, that tells us more than 20,000 people were actually exposed. But only those ones that manifested, reported at the facilities, or maybe managed themselves at other places.
So that means that the numbers could be more than we are even told.
Certainly.
Yes.
Way more than that.
Certainly. Those who were actually exposed. Like I said, it's not all
20%.
people who are exposed who manifest clinically. So once we had that, it tells you the gravity of the situation that we have in Greater Accra.
I see.
And the water situation has not improved. But thank God, I think a few weeks back, water is being provided to certain parts of Accra that for decades have not had any water. We hope that will help improve the situation there. But there the challenge is not over, because we still hear people complaining about the water not reaching them because pipelines are burst and all kind of things. And those are the sources where the contamination will take place.
I see. So, Dr. Vanuatu, so some way, somehow, we managed to curb the situation. We managed the situation to a very large extent. How did we go about it last year? What was the approach?
Let me just add here that the cases have not stopped completely.
They haven't stopped.
You see, from what Dr. Elisa said, it's just a few. If you take 100 people, maybe 20 are the ones that showed the symptoms, and that is the 20,000 that we are seeing, which means that quite a huge number of people still carry the germ. And if we continue the way we were doing before, it means that we'll continue to see cases coming. The good thing, however, is that we are not recording deaths. So it is very, very important. And he also mentioned about the water and the food. We managed it through education, public education, and then also treatment at the hospitals. When people came to the hospitals, they were given infusions if they had to get infusions. And then it was continued with oral rehydration salt, the ORS. And then we also continued with public education. We had several radio discussions. We had a lot of media discussions. We went into the communities. We did so much. But the conditions that helped the cholera to spread were still there. If people continue to defecate anyhow, they continue to eat food that is not hot, if it has to be, or they do not wash their hands properly with soap and the water that is poured onto your hand. And here we want to bring in where people go to eat. You know, you go to a place to eat and you are provided with a small bowl of water, and the people dip their hands in, wash their hands and eat. If you have any germ on your hand, you have washed it into the water, it is still there, you are using the same hand to eat. But if you poured water on your hand, at least you wash it out. And then people also continue to defecate into plastic bags, throw them into the gutter. Rains come, they wash them into wherever. People fetch the water, drink and all that. Or people use the big drains in town as their toilets. And when it rains, it washes the water with the toilet and everything, probably into the markets. So we find that the cycle continues. We've done a lot of public education. In fact, it's not just now that we have had cholera, it's been there. It's only that by God's grace, we didn't have cases in 2013. But 2012, 2011, you realize that we had over 10,000. But this time round, 2014, it was just too much.
Just too much.
So we need to continue with the public education.
I see. You mentioned something about the rains setting in and washing some of the excreta and all into the water bodies and all. So we are just 6 months or so away from the rainy season yet again. So are we expected to see something like that happen again? Many more cholera cases?
If we continue the way we did, we would. You see, the rains did not fall in June alone. It rained virtually every month. And already this morning it was drizzling. So if it continues and people continue behaving the same way, then we have to be prepared as the health sector. We have to stock our infusions and everything. And one other thing is that cholera treatment is free. When people come to the hospital, we have some infusions that are for free, which we give them.
Some for free?
Yes. So if you look at the numbers that were treated, and imagine that each person maybe spent 100 Ghana cedis, you multiply by 20,000, and you see the amount of money that has gone into it. So apart from the people not being able to do their own work because they are sick, and also their families not doing their own things because they are looking after sick people, the burden on the staff and on the space, there's also the money involved. So we need to continue to talk about cholera. And I'm happy that now people are doing this cleanup within their areas and the rest. But our hope is that the waste will be properly disposed of, so that if the place is clean, then it is clean, and people would not infect themselves. Again, the sad thing is that children were even infected. Old people, young people, even children. Which means that as parents, as caregivers, we are also not monitoring our children. They should be eating from the house. Or if you are buying food for them, let them buy food that when they eat, they will not fall sick. And when they fall sick, as soon as possible, they should be sent to the hospital. When you have cholera, you're actually losing almost all the water in you with some salts. That's why we treat with the infusions and ORS. So even before you get to the hospital, if you have ORS at home, you can start drinking that. If not, and you have kinke, you can mash, but that will not be able to replace the water that you are losing. So as quickly as possible, go to the nearest health facility. If you need to have an infusion, it will be set up for you. Then at least we'll save lives. We were not happy that we lost 121 to cholera in Greater Accra.
Greater Accra only?
Yes.
Wow. Dr. Eliza, let me come to you. So she's mentioned quite a number of things. Some are heartbreaking, honestly.
Yeah.
So the rains are coming in yet again. Yeah. And I'll repeat what I asked earlier. Are we prepared for any such thing? The rain setting in, coming in with its associated cholera cases, because obviously people are still defecating around, and they are. What is that approach by the Ghana Health Service? For nothing at all, let's focus on Accra. Our people in Accra, what's the plan to contain the situation should it come out again, probably in the next 5 to 6 months' time?
Okay, thank you. Let me start by saying that health, they say, is made at home. In other words, like she said, we are doing a lot of public education as to what people should do or not do to avoid cholera. Hand washing, make sure you don't defecate and throw it anywhere. Eat cooked hot food, and then make sure that if you are going to eat these fresh vegetables that you don't need to do anything, you wash them with vinegar if possible, and then hand washing and then keeping your environment clean can only be done by you in your home. We have the duty as a health service to tell you what you do, because when we tell you wash your hands before eating and after going to the gents, and you decide not to do that, what can we do? Because we are not with you. We can only tell you what to do. And if people follow some of the issues that we raise on radio or when we have debates, you realize that it will go a long way to improve the situation that we have. Because, of course, if you go to maybe contaminate your hands and things, and you come and wash them with soap under the running water, like she said, then you are preventing cholera. You will not get it, even though at the point your hands were contaminated. If your water that you use, you suspect that where you are getting it from is likely to be contaminated, and you boil it before you use, then you'll be preventing cholera. So some of these things, if you do them, though the environment is still ripe for cholera, you can still avoid the cholera situation.
I see. You also mentioned something that the cases haven't reduced. They keep recurring.
They've reduced.
No, the cases haven't been eliminated.
Yeah, we have not declared outbreak over because we still having cases when we test are positive. That's why we have not.
So let's say between November 2014 and I mean, around that time, you had managed the situation to a very large extent. Yeah. So let's say from November 2014 up until now, January 5, 2015, how many more cases have you received? Any deaths?
Yeah, we had 98 cases.
Okay, between November and now?
From all the districts with one death.
One person died.
Yeah, that's why we had 121, because from as far back as August, we had stopped at 120. Until recently, we had an additional death, which was making it 121.
Yes, I want to add on that. Apart from the public education, we are also looking at how we managed our cases. Although we, as I said earlier, if you took 100, less than one died. We are looking at those who died, what happened, because that will help us to do our public education in a targeted manner, and also to look at our own work that we did. Where could we have done better? So we look at everything, and that is what we call the auditing. We are auditing our deaths, the 121, as many as possible. We'll audit them to see what happened, and that will make an input into how we'll manage another one should it occur. We pray to God that we don't get such huge numbers anymore. But the worry is that we still record cases that are positive, which means that despite the public education, several fora, we are still getting people not adhering to what they should do to prevent cholera. And we are thankful to God again that the holidays are over. We were really concerned that Christmas time people eat out, they do all sorts of things, and maybe, but by God's grace it did not happen. But we'll continue with education, and that is why we as the Greater Accra region, the Health Directorate, have formed what we call the Clean Environment and Communities Initiative, where we are looking for funding to continue with public education to the minutest community. Again, the largest number of cases, about 50% or more, were recorded in the Accra Metro. So we need to do a lot of down community education. Apart from the radio and the television, we still have to go as close to the people as possible. Not alone, not Ghana Health Service alone, but in collaboration with other departments whose work will help. For example, you can take the NCCE, you can take the social welfare, many of them, the Ghana Education Service and the rest, will do it together, because school children, when they go back to school, will also eat. They don't have toilet facilities, they also go to toilet anywhere. So there's so much that we are going to do. And so our project is to look at how we can raise funds to be able to do this continuous public education for the next 3 years.
So beyond education, so now let's see.
Let me also add that we have identified the hotspots. Though Greater Accra is generally involved, we have certain particular areas that were actually well hit, and it has been areas that always get most of the cases.
And these areas are?
No, we have a, what do you call this?
Feel free to chip in if you need to, because we obviously need to know some of these areas.
Ablekuma as a sub-metro.
Okay.
And then Ayawaso. Okay. Ayawaso. And then La. Okay. And then Gasaf. Okay. These are the key areas.
I was just about moving to areas, particular communities in some of these areas you mentioned. I mean, looking at an area like, say, Begbese, Choco, and all these areas. So you go there to educate these people, to talk to them, but their problem is not about the talk. Yes, we've listened, but we do not have a place to ease ourselves. What do they do?
That's why I said that it is beyond Ghana Health Service. You see, cholera is actually a developmental thing. It is not health. It is not just about Ghana Health Service. Because if you look at what will let it thrive, it is not because we as Ghana Health Service do not have hospitals. It is because the people are defecating anyhow, anywhere. It is because they don't have access to good drinking water. It is because they don't have access to water to wash their hands and also keep themselves clean. It is because they don't have a place to dispose of their refuse very well. If a place is clean and somebody is going to drop toilet over there, that person would feel a bit guilty. But if you have a heap, the person can easily dump anything anywhere. So it is a collaboration. That is why we work with the assemblies. In fact, during the cholera outbreak, we had a lot of work with the assemblies, with the regional minister and his team, with the various district assemblies. We met them several times, discussed it. So that means that the issue about provision of toilet facilities, why should houses be built without toilets? Something must be done. So if there's a law, it must be enforced. So you realize that for us to address the cholera issue, it's not just about Ghana Health Service. It is a wider scope. And the assemblies play a key role. If people are selling food that is uncovered, they have to be impounded. Because if the fly settles on it, somebody will buy that food, eat, and fall sick. We will see the person when the person is sick. And that is why we continue with the education and we continue with the preparation in our hospitals to ensure that when they come and we have infusions to give them, the infusions are there. Or we need gloves to use, the gloves will be available.
I see. Interesting. Let's move on. Still reviewing 2014, the health sector and all. And MDGs 4 and 5 talks about, the child mortality and the maternal mortality. What was the situation like last year? How many deaths? What was the situation like?
Well, last year we had 100,000 plus live deliveries or live births.
Okay.
Out of that, there were casualties with respect to their mothers. We had 182 mothers dying.
182 mothers
dying.
That's a big number.
But let me quickly chip in. It is not all of them that were pregnant and have gone to deliver and died. It includes those who maybe got pregnant where in local parlance they say accidentally and wanted to terminate it. And the process, abortions went to quacks or something, and when it became critical, they rushed them to the facility and then they died. So once the death is related to pregnancy, you consider it a maternal death.
So what percentage does this make?
I don't have the figures right now, but it's quite significant.
About half of the number, or less than half?
Less than half.
Less than half.
Yeah, it's quite significant. And you realize that if you look at the maternal deaths, over 70 of the 182 fall below age 25, which is very serious. It means the very young mothers are dying.
So there's a problem somewhere.
Yeah.
Where from the problem?
Well, multiple. If some of the cases that die, the time they go to the hospital, there's very little you can do. Or in other words, we say there are delays. And the delays can be in various stages. Is the time they set off from home. By the time they go to the hospital, maybe it's too late. So even if they needed blood, by the time they go there, it's too late to get them blood. Because they came in gasping and they will die. But we also realize that as a region, we have a challenge where when mothers in such emergency situations get to hospital, they keep on moving from one hospital to the other because of other challenges with bed space or even professionals to handle those cases. So we are trying to address some of those challenges. That one I will leave to my boss to talk. That's
so is there a possibility of you prioritizing such people? So maybe
that's what you'll be talking about.
Okay.
About what we are. But we are introducing something we call the call center. It's her pet, so I wanted to rather talk about it.
Sure. So maybe you can talk to us some more about the call center and about some of these things.
Yes, I think maternal death is very painful.
Indeed.
Because they are not sick. These are women who were pregnant and went to deliver. One thing is that a lot of them who die from 2 or 3 major causes. One of them is bleeding, where the woman bleeds either while she's still pregnant or after delivery, she can bleed to death. There's the other group that have a raised blood pressure. And sometimes when a woman is pregnant and she becomes too big, they think that she's going to have a boy, baby boy, or she's carrying twins. If she has slight headaches or she says, I cannot see properly, I have blurred vision, those are signs to send her straight to the hospital because the blood pressure may be going up. If you don't manage it soon, then she can start fitting. And when it happens like that, that becomes a big challenge for the hospital, and that is where a lot of them die. And then he's mentioned the abortions. So we find that if we are able to manage the bleeding and also manage this raised blood pressure, we will be saving a lot of lives. He also mentioned that sometimes it's to do with bed space. You go to one hospital, they say we don't have a bed. Now they have to find another place. So this call center is a place where the first place that she goes to, they'll make a call to this call center and they will ask what the challenge is. They may say that this woman has come and her blood pressure is this over that. And she'll be linked, whoever is making the call will now be linked to a specialist. So that specialist will listen to this issue and then give an advice as to what they should do. In the meantime, somebody else will be looking for where they have a bed available so that this woman can be sent directly to this place. So it will not be like now she'll move from one hospital to another, we don't have a bed. And sometimes it's in the night, it becomes a big challenge. Again, we are linked to the National Ambulance Service. So the ambulance will also be there to carry this woman so that those delays will be minimized, you know. And again, we have what we call the early warning systems, and we have that in terms of looking at where there's blood available. So depending on what her group is, even if that hospital doesn't have blood, we can look through this and immediately get a place where there's the blood and carry this blood over to where this woman is. It's not just for the mother, but it's for the baby as well. Because we also had a lot of stillbirths, babies who were born dead. In fact, a huge number. Sometimes it's very, very painful talking about these things, but this is what is actually happening. So from our side, we are going to run this call center, and then we continue to look for blood. We have a lot of public education. We have communities where people actually donate blood. So we'll intensify that because they die from bleeding. So if we have blood available, then when a woman comes and she's bleeding, that is fine. As we do all this, we are also strengthening our own system because some of them may die from anesthesia-related complications. So we have to strengthen that. Or when they come, the doctor is not available. So this on-call, if you are supposed to be on call, you are on call. For some of the places, we've even put together a place where they can stay overnight. So you are there. If you have an emergency, you are not now going to be called from the house to come, but you'll be there and you can see to this woman immediately.
I see.
Let us also say that we have reduced a little bit compared to 2013, but it is not what we expected. We expected to have gone down even further than this.
So what are the figures for 2013? And
we had 201 maternal deaths
in 2013.
In 2013, but you see, we normally look at it per 100,000 live births. Okay. We had over 100,000 live birth deliveries, and we had 182. So that gives us about 181 per 100,000 live births. So out of 100,000 live births that we had, 181 died, which is lower than what we had the previous year, okay, which was about 200. And that time, Greater Accra had the highest number of maternal deaths. There are also the people who, they don't want to be pregnant, but they don't use any form of protection.
Okay, we'll be coming to that point shortly. But this call center you speak of, is it up and running?
We are just about to start. Okay. The place is set up, and we are working with the MTN to do this. The place is all set up. We are in the final stages of putting the final touches together.
I see.
And then we'll start.
So do we have the number? Can we share with viewers?
When we are ready, we'll share the number.
No.
We'll come back and we'll talk about it and show you how it runs. I think it will be good for you to even pay a visit
Indeed.
to the
Indeed.
place to see how it runs and then how the whole setup is. And that will be very, very helpful so that people can have access and they will know that we have this to help us to address our MDGs 4 and 5.
Indeed, we'll follow up on that. We'll follow up on the particular one. So now, to the issue of the other...
Before we go there, since you mentioned maternal and child health, let me chip in the aspect of child health. With respect to the children, their health is very important, and we usually protect them by immunizing them right from birth. As a region, we had a target of 151,000 plus to immunize. That's under 1 children that we were supposed to have immunized. But unfortunately, we're only able to reach 114,000, leaving a gap of about 36,000 unimmunized. And this because of some of the challenges that we have as a region. Challenges in that one, some of the districts we have don't have a means of transport to reach the remote communities to get to the children. And where they had the vehicle, was challenged with maybe fuel to move because the inflows were not coming for them, for the various districts to run. And so we had those challenges. We also had some of our facilities which were in private homes, but because of the electricity situation, they had to sort of tell us to move out because our fridges and things were consuming their electricity and the bills were going up. Okay. So we had those challenges which made us not to reach the 151,000 that we expected. But we hope that this year things will improve so that the numerous community health nurses we have will be put to maximum use.
Dr. Elisa, you mentioned something about quite a number of the deaths we heard of through abortions. Yeah. Are we still having such huge numbers with regards to abortions in the country?
Oh, yes. And you see, what we even get at the hospitals is the tip of the iceberg. Because like I said, people go to quacks. If it becomes dangerous, then they rush them to the public facilities for us to complete. It tells you that a lot of them who may be, by the time they were at the quack's place, but still normal, will walk home, and at home that they may go and start having problems, and some may die before even reaching the hospital.
So what happened to all those family planning methods we saw? I mean, we see most of them on TV, we hear them on radio. Yes. So how come we are still seeing so many unplanned pregnancies and all?
They are still available. You see, people have misconceptions about family planning. For example, somebody says that if you put in the IUD, it will travel into your heart. There's no way that will happen. People think that if you use the family planning, you would have all sorts of problems. When you go to the family planning service center, they don't just give you anything. They have a chat with you, and then they examine you. They discuss with you first before you are assisted to choose a method. So it is based on you. You see, unfortunately, we even have children becoming pregnant. So it is not just even about having the family planning services, but about talking to people about sex, about pregnancy. How can you have it we have children between 10 to 14 years also becoming pregnant.
10 to 14?
Yes, delivering. Some of them, unfortunately, going through abortion, or some of them even dying. People between 15 to 19, quite a huge number, becoming pregnant. All these girls must be in school at that age. So to ensure that these things work, again, we have other sectors that have to come in. And parents have to play a role. Why should a 10-year-old girl be pregnant or a 12-year-old? Because she doesn't know, she doesn't understand. That's why we have to teach them about pregnancy, about what will let you become pregnant, about sex. The Ghana Education Service, they have school health programs, and they work with us as the Ghana Health Service. So now our adolescent health unit is doing quite a lot in terms of getting the right information to these young children and giving them opportunity also to ask questions. There are so many things. People do not need to be pregnant when they don't want to be pregnant and go through abortion. I think that that is not the right thing to do. The right thing is that if you don't want to be pregnant, there are facilities available for you. You can go to the hospital, talk to the public health nurse, or talk to the doctor, talk to another nurse that I want to come and ask about pregnancy and all that, and they will help you instead of you waiting to be pregnant and then trying to abort and either dying or coming down with a complication.
We live in a society where even walking to a pharmacy shop to even get a condom is a problem. People, even whoever it is that's selling it to you, looks at you and just sizes you up and down. And really, what do you need a condom for, sort of? So how do we address this particular problem? Because if I know that, yes, indeed, I'm going to walk into a pharmacy to probably get something, or I'm going to see a doctor to assist me choose a method, and I know this is how people are going to see me, where from the edge to even go there in the first place?
Let me say that at the hospitals we have the public health units where the public health nurses are. Some places we have the doctors as well. If you go there, that is the right place to go to. We even have extended working hours, and we even have weekend working hours so that people can go. We are trying to make it more available and more accessible instead of the previous times. And as we do all this, we also work on our customer care. So our staff are not supposed to be looking at you. Otherwise, why are they there? What do they want people to do if all these services are available? So we are doing that so that people, our staff, can offer this care without any discrimination, without any stigma. And again, we even have some of our people going out, you know, outside the facility to talk about family planning and carrying some of them so that people who are outside and do not want to come to the hospital or the health facility can also have access to it. I hope that people will hear us and realize that they can go to any hospital and ask for family planning.
I see.
Maybe with the issue of the condom, one way we've also tried to address the challenge you just mentioned is that in certain communities, we have introduced what we call peer distributors. So their colleagues come to the nurse, take the condom in bulk, and then the peers know that when they go to this colleague of theirs, he has the condoms to distribute, and then they go and buy them from there, undercover. So they are comfortable dealing with their peers. So that's one way we are addressing those. But it's not all the commodities that can be given out by people who are not technically trained. But with the condoms, that has been done, and it's helping a lot in some of the communities.
Wow. And lots more things we wanted to talk about today, but it's rather unfortunate at time, because I wanted us to touch on malaria, for instance, quite a number of days. I'm sure we'll have to bring you back and talk about all these things. We'll do that. So you just heard from the Deputy Director for Public Health for the Greater Accra Region, Dr. John Betson Eliza. He joined us together with the Director of the Ghana Health Service, the Greater Accra Region, Dr. Mrs. Linda Vanotu. Please, anytime you mention the name, add the Mrs. Dr. Mrs. Linda Vanotu. They joined us on my banner to actually talk about some health-related issues. We touched on a number of things that happened in 2014 and the way forward this year. So that'll be it for my banner. Aisha joins me pretty shortly. We'll be wrapping up the show in some few minutes' time. Do stay tuned. We'll be right back after this.